Well, welcome to everybody. Appreciate everybody joining. Got a fairly short agenda, although I'm not sure how much discussion we may have, so we'll jump right into it. The minutes were sent out in advance. I know Kathleen and I looked at it just a little bit ago and made a couple of minor tweaks. I'm not sure, Kathleen. Yeah, you got it up on the screen. It was just a couple of typos, more or less, that we corrected. Nothing major. Anything you want to point out in this, Kathleen, that was different than what you sent out?
It was really typographical errors. So,
it was just a factor of speed.
Yeah. I appreciate that Jim is retired now so that he can prove my work.
Well, I guess I would make a motion then that we adopt these, accept these, approve these, is probably the right word. So I'll make a motion we approve these minutes as they are written and presented here on the screen. If I could get a second for that.
Shane will second that.
Okay, and anyone opposed? All right, great. So we'll consider those approved. And that'll take us to the first real item for on the agenda, which Crystal, I think I saw you had joined. Wanted to give an update on the affordable housing bottleneck and an update there. So I'll turn it over to you.
Okay, thank you. Can I share my screen? Thank you, Kathleen. Hello, everyone. I hope everyone is doing well. I just want to talk to you guys a little bit today about the Bottlenecks to Affordable Housing group. This work group started meeting back in fall of 2021, and our task was to identify ways that the COC case managers can help improve clients' access to affordable housing. The work group consists of community providers represented by outreach, our shelters, and our homeless and housing programs. We began by identifying the bottlenecks, and we narrowed it down to 5. And then we began discussing the solutions. We chose short, medium, and long-term goals, and the 5 bottlenecks that we believe were the most prevalent in our community were the lack of affordable housing, the lack of quality housing and newer units that will pass inspection, and strict requirements for tenancy approval for the income-based units and other affordable housing options. Also, lack of wraparound services needed for client housing stability, and lack of access to mental health and substance abuse services. Our short-term goals were something we were able to complete quickly. We reminded the case managers they could offer double deposits as a tool to incentivize the landlords, and this was especially useful for some of the difficult households to house, to help the case managers with ongoing professional development, particularly with the inability right now to meet in person for trainings. A member of the work group, Reed Ferguson, with the Empowerment Project, provided training modules from OrCode, and OrCode is the developer of the SPDAT assessment tool we're currently using in our community. For our medium-term goal, we decided to hold a Housing Connections Day for case managers. This will be a one-day event when case managers will tour available housing units to help clients determine unit suitability. We've always encouraged the clients to view the units themselves before applying for a unit, but this is usually a challenge for them, transportation and other issues. So this will give the case managers an opportunity to see the available units and can help the clients to decide if the clients aren't able to physically view the units. We are planning to hold this event late February, and we want to this event to also double as an appreciation day for the case managers. The we haven't really been able to meet with them in person or do anything to show appreciation because we can't meet in person since the beginning of the pandemic. So we're wanting to do something for the case managers as well. We chose 3 long-term goals. First, we want to see if we can develop a feasible plan to match units to clients. We plan to have a discussion with CIC staff, the assessment team, and other community stakeholders to see if there's a way we can review the by name list for the most suitable client when a unit is available. The rapid rehousing staff would offer the landlords double deposits and possibly a non-refundable incentive to set certain units aside for us, and the deposit would stay with the unit at client move out. Any deposit monies the landlord would use to make needed repairs to the unit would be replaced for the next client's tenancy, essentially holding these units for our clients. We also identified a need for flexible funding that would allow the case managers, the landlord engagement specialist, our housing navigator, and the inspectors to offer the landlords incentives such as sign-on bonuses, repair assistance, risk mitigation, etc. And we've found out recently we do have some funding through the city. It is HUD funded, but it's immediately available to offer sign-on bonuses and repairs to current program participants' units, above the amount of the security deposit. So this will help us to work on that first long-term goal, where we can offer incentives and help with repairs. The final long-term goal, the work group recommends that robust case management training to be ongoing and consistent, and to provide beneficial materials from appropriate training resources. We have not been able to, again, meet in person for group training sessions since the beginning of the pandemic. So an idea was presented that possibly we begin holding short training sessions during the virtual rapid rehousing team meetings that are already scheduled on a monthly basis. So that's what we have to report at this time. We will continue to meet bi-weekly to develop plans for reaching the rest of our goals. Does anyone have any questions?
Appreciate the update. Any questions from anyone for Crystal? All right. Well, thank you, Crystal, for the update.
Yes.
Crystal, what resources do you think to help achieve these goals besides the HUD money that you said you have?
More flexible funding. If we had some more flexible funding that we could offer some other things to the landlords, maybe like things like, well, let me think. The risk mitigation fund, for one thing, where we can tell a landlord, we have this money set aside for you if there is an issue with a unit and a client, we could possibly help with that kind of thing. If the landlord knows that there's some funding out there, that if a client were to damage their unit, that they could get help with those repairs, I think that would be helpful. For the trainings for the case manager, I think if we could bring in some of the other service providers, particularly like mental health, substance use providers, to provide training to the case managers. And just, I just feel like the ability, I know we just can't meet in person right now, but I think at some point, if we can somehow manage that with social distancing, that would be helpful as well.
Okay. Thank you.
And then we may need some money for the Housing Connections Day as well.
Well, if you can't meet in person, is there a way to do it virtually?
We have been meeting virtually. We've been training new staff virtually. It just doesn't work as well, I don't think. That's my personal opinion.
Yeah.
Plus, you don't get to know each other when it's just virtual. So
Right.
there's not that personal connection.
Definitely not as good. It was just an all or nothing. I just wondered if there was something in between. Sounds like you're thinking through that. Okay, any other question?
One of the things I think we're seeing all across the homeless service providers is we have a profession of people who went into this work because they like working with people. And 2 years in, they're struggling because they are not it's hard to make connections virtually, particularly when you're doing this kind of intensive case management.
And
Right.
We're hoping to be able, with the Housing Connection Day, make it a meet and greet for the case managers as well, because there's some that have been with us close to 2 years that we've never met, and they've not met one another if they're not working for the same agency. And even though we all work for different agencies, we work as a collaboration, we work as a team, and so it's important that we get to know each other.
Well, this will continue to be an issue for some time. It's not
That's
something
true.
that's easily solved.
Yeah.
We may ask you to come back and give us more updates
We'll be
as
glad
things
to.
progress. Yep.
I'll be glad
Thank you.
to. Mhm.
All right. Thank you, Crystal. Any other question?
Thank you, guys.
before
I
we
appreciate
transition?
it.
Thanks,
All right.
Crystal.
We do have one item we're going to need to get a recommendation. Sharika is going to present this here in a second, and we'll need a vote. So the topic is ratings panel recommendation. So Sharika, I'll turn it over to you.
Thank you. So this is the ratings panel recommendation for our city ESG and state ESG funds for fiscal year 2023. This year we did have fewer agencies apply for city ESG funds, and we did have some agencies change the funding type that they normally provide. For instance, Bethesda Center, who we have first, is no longer requesting money for shelter operations. Instead, they are requesting money for street outreach. It has been recommended that we fund them in the amount of $50,000. We have Citywood Dwellings, the recommended amount of $36,000 in city ESG and none for state ESG. We have ESR receiving their regular amount of funding from state ESG of $16,352. We have Family Services who did not apply for city ESG this year, but will be receiving their annual state ESG of $25,710. Then we have the City of Winston-Salem. The United Way currently assists with operating the emergency voucher program. That program is placing families who are literally homeless, so they're connected through street outreach and emergency shelters into a motel until shelter space is available. We have that at a total of $16,104, and that is from city and state ESG. Then we have our Samaritan Ministries, who receive their annual funding of $25,710 for state, $18,982 for city. And then we have an increase in the overflow winter shelter. That is usually around $11,500. We've increased that to $33,585. That is for the operation of the winter shelter that runs the winter months for single individuals. And that is done by United Way and Citywood Dwellings. Then we have our rapid rehousing portion of the grant. We can only use a maximum of 60% for shelter services. So that includes shelter and street outreach. The non-shelter services, which is housing services and HMIS data entry, we have United Way We're doing the same amount as last year at $41,123. And then we have them for the housing services with rapid rehousing, $55,000 in city, $43,451,000 in state. And then we have a new agency for city ESG. They are not new as far as providing services, but they are new for this funding stream. And that would be Positive Wellness Alliance. They are also our HOPWA grantee for Forsyth County and a few other neighboring counties. They will receive $38,000 in city ESG funding. So we do not know the actual amounts that we will receive for 2023. We use the amounts that we received for the FY 2022 funding as a guide. And as the amounts come out and we know what is available, the rating panel will make recommendations if anything needs to be changed. So this is the recommendations they have for the FY 23 fiscal year.
So a couple of questions, Sharika, and you were touching on this here in the last part of what you were talking about, but I was curious how this compared to prior year. And then you said not as many agencies applied for this as has in the past. I was curious as to why. So, okay, so you're pulling up a comparison.
Yes,
Okay.
so previously, why we do not call agencies and ask them why they don't apply, but we did see that Salvation Army is one agency that did not apply this year. Family Services, they apply for city, state, and not for city. From my understanding, some just missed the application deadline. There is a strict application deadline set in place by the budget office. And then we have street outreach with Bethesda Center. As I said, they changed their program. So we've always provided funding for their shelter operations. This year, they've decided to provide funding for street outreach instead of their shelter operations.
Do we remind the agencies when deadlines are coming up for these applications? And so we did. I see Andrea nodding.
Yes.
So the fact that they missed a deadline, that's squarely on them, right?
Yes, we're not able to go back and open up the application because it wouldn't be an equitable application process for the other agencies that applied.
Okay, so total funding for 22 is the same dollar amount as what?
Yes.
23 is. So it's just being reallocated across. Okay.
Yes, just because we are not sure how much we'll receive until the end of this year. With state ESG, we won't know until around September, probably October, November time is when we actually know how much we're going to receive.
Okay. So maybe saying it a different way, same funding dollars as what we've had in the past. We'll just make sure we allocate it across where it's been applied for. So we're not losing services as a result of some not applying.
Yes.
Okay.
We instead increased some requests and instead of losing the funding, yes.
Mm-hmm. Okay. So any question from any of the group before we ask for a motion here? Okay. I will move to approve this as Sharika has presented it. Ask for a second.
Second.
I think that was Robert. Any opposed? Okay, so thank you, Sharika. We'll consider that approved.
Yeah.
All right, we will keep moving down the agenda here. Andrew, I'm showing you up next with the point in time count as a topic.
Okay. This one's going to be very quick. I'll do a little background. For those of you who've been around, some of this will be review, but for those of you who are new, Every year, we have traditionally done what's called a point-in-time count, which is a one-day, once-a-year count of everybody who's homeless in Forsyth County. And we do this because the money we get from HUD with the continuum of care requires us to do it. The requirement is actually to do it every other year, but we've chosen to do it every year. One, for the consistency of the longitudinal data, also because it keeps the volunteers engaged more frequently. Last year with the pandemic, well, so the point time count comes in two parts. First part is a shelter count, where we look at everybody who's in a shelter program. And the second part of the point in time count is a street count, where we, before the pandemic, would send teams of volunteers into the community to count everybody we could find who was homeless, sleeping outside on the last Wednesday in January. Once the pandemic hit, HUD agreed that this was a bad idea to do that street part of the count by sending volunteers out into the community to count. So last year, when we did the January 2021 count, HUD agreed to let communities do the shelter count as normal, but then use a street count based off of a by name list of people that their street outreach teams had been engaging in and connected with over time, which is what we did last year. This year, HUD does not want to do that. HUD is asking communities either to not do a point in time count or do a point in time count based on an actual street count census. So we had a few of us met, discussed our options, and decided our recommendation is not to do a street count. We think, particularly now, is a very bad time to send volunteers out into the community to identify homeless people sleeping outside. So since we've always done it every year, take advantage of the regulations and not report to HUD our street count this year based on a street survey. We still have to turn in a point in time count, but it'll be based on the shelter counts. And HUD's fine with that. And then we will still do for our own community, we will continue to use this by name list that we are keeping for the street outreach work. We actually think for our community that by name list is a much more accurate accounting of who's sleeping on the streets at any given time than the one night census. So we will still have the data locally to use. We're just not reporting it to HUD. Any questions about that?
Any question?
So Andrea, does that mean that next year we will have to do a street count?
We will have to do a street count next year, yes. So hopefully we will not be in the middle of a massive wave of COVID at that time.
Now, if we're not doing the street count, is there sort of a notation that, hey, these numbers may be lower than, baseline because, hey, we're actually not counting a count in our reporting?
Yeah, I think, one of the things that we discussed, and locally we have a disagreement with HUD, we think our by name list that we keep is actually a much more accurate count than the one night census. So our one night census, which is what we've used for 30 years to report to HUD, relies on a group of volunteers that have been trained typically that night, going out. Many of them have done it for multiple years, right? So have years worth of experience doing it. But they go out one night, they try and find people, they try and count them. Versus what we've been doing with our by name list, which is our street outreach folks go out on a regular basis, on a weekly basis, and try and engage anybody that's out, that's sleeping outside. Where HUD's concern is some communities on that by name list only keep a record of people who are engaged in service, right? So if I'm a street outreach worker and I come up and I say, Mr. Smith, I see you're outside camping. Do you have another home? You don't, you're homeless. Do you want services? If Mr. Smith says no, some communities don't put him on the by name list. In our community, we will put them on the by name list. So our by name list includes people engaged in services and people not engaged in services. So because we're going out on a consistent basis, recording everybody that we're engaging with, both engaged in services and not, we think that's more accurate than the sort of like, maybe we'll find people, maybe we won't. So, you know, in the past years, our street count has ranged from a low of, I think, 10. And that 10 was a night when we had blinding rain. And then it's gone up until last year. I think the high was somewhere in the 60s, 70s people, even though our street outreach folks every year have been saying we have about 70, 80 people on the streets. Right now, our street outreach list is sitting, I'm waiting for this week's report. Last week it was 250, but this week we think it's gone down to about 220. So we think we have more people on the by name list than we would if we did a street census.
You're keeping two separate lists, two separate census, so to speak, for different purposes, and one you feel like is more accurate than the other. And so we can always look at both.
Yep.
But you got to make sure you're fulfilling what HUD's asking for.
Right.
At the right time. Yep.
Andrea, just to clarify as well with HUD, the reason why the by name list wasn't solely able to be used was because there was some uncertainty because we didn't have a validation point for the past. And now that we have that, moving forward, if we were to use it, it would be okay. But in the previous year, we didn't have a validation point for the past that we can compare it to.
Okay. Any other questions?
Okay.
I know that Derwin is up next on the agenda, and I don't see him on the call yet.
Yeah, I didn't see him either. I was going to ask if someone else was joining for that topic, which is
I have
City's
not heard.
Affordable Housing Commission. Okay.
We've been reaching out to him. I just sent him a text. Kathleen has been emailing him. So I don't know what's going on with Derwin right now. But while we're waiting to see if he jumps on, let me squish in a agenda item about the isolation shelter.
Okay, please.
Just an update for everybody. As you know, United Way has been helping facilitate for the continuum of care the isolation of people experiencing homelessness and who are exposed to COVID or need to isolate because they are COVID positive. And up until January of 2022, that was going along quite quietly. At most we ever had about 13, 14 people in isolation at any one time. In the first almost 18 months of the pandemic, we had needed to shelter about 60 folks that were both homeless and needed to isolate because of COVID. As of this morning, I think we have 65 people in isolation right now. So the last Thursday, Friday, Saturday, we put in 45 people in those 3 days alone. So Omicron has definitely hit the homeless population. Number of our shelters are down to skeletal staff because it's impacted their staffing. Last week we were concerned that we were going to run out of hotel rooms. We've been using a hotel for isolation. And so we began looking for alternative spaces. We have not found alternative spaces to run an isolation program. I will say, thanks to whatever forces are in the universe, we have managed to keep enough hotel rooms becoming available every day that we've been able to isolate everybody at our hotel. So that's where we are with isolation. We are still seeing very high numbers of people coming in for isolation, probably between 5 and 10 for the last 3-4 days. So hopefully at this pace, now that we have, we're far enough into Omicron that we have people exiting the hotel because their quarantine periods are over. So we're freeing up rooms that we've had, and so we know we can refill them. And the hotel has had some vacancies, so hopefully we'll make it through the Omicron surge and not have to worry about a second site. But that's where things are. I will also say that hospitals have been great partners in this, but they are also slammed and struggling both with staffing issues and with capacity issues. So we've been prioritizing getting people who are in the hospitals and need to be isolated with us out of the hospitals. And we've been able, except for the intervention of the snowstorm, we've been able to do that pretty quickly for them. So
The folks are cycling through, some exiting as others come in.
Yeah.
Does it look like maybe it's leveled out or even starting to recede some? Is it too early to tell?
I think it's, I think we've sort of evened out the pace of it. I mean, I think when I met with the health department director last week, he said we were 2 weeks away from the peak. So I expect that we'll stay at this pace of 5 to 7 a day for the next probably week or so. And then hopefully we'll pull back a little bit at the pacing.
Right.
Andrea, in the beginning, Public Health and DSS helped do a shelter at the Daymart building.
Right.
That I know that all those offices have been refilled back with offices again. Is that an option if surges happen to go back to that space, or is that just it's out of the realm now?
I haven't asked that question of the county. And I think my understanding was it's an agreement with the county around the use of that building, that it can be used as an emergency isolation shelter. So I haven't had to ask them, but I do think, I mean, if things got really bad and we had no other options, I think we can do that. When we did discuss it a little bit with the health department director, it's to empty those offices and then to put in place the barriers we would need you to make sure it's safe space for everybody with the virus, is at least a week turnaround. So that's, I mean, one thing we sort of have to factor in is that turnaround time.
Absolutely. And it wasn't very much used in the beginning. We expected it to be used a lot, and it was not.
It was, no, it
but
wasn't. I think we had
the surges of cases may be useful, but
Yeah.
we'll see.
We will see. So.
It looks like I was looking at just now. I was looking just out of curiosity to see what cases are doing in North Carolina, and it looks like cases are trending down. It's a little early to maybe state that, but
yeah,
it went up sharply, and it looks like it's coming back down pretty sharply. Hopefully that'll hold, but time will tell. And hopefully this population will follow that same pattern.
Yes. And maybe for Forsyth County, this like back-to-back winter weather events will keep people inside enough to bring the spread down a little.
Yeah.
So unfortunately for the homeless population, it means that they're isolating. I mean, they're hanging out together more intensely.
Right.
But I think part of last week's bigger challenge was we had 2 shelters with outbreaks. So hopefully, because Omicron's now been through the 2 largest shelters, we've hit the worst of what we're going to see in the homeless population.
Well, appreciate you scrambling the way you have to make sure we were covering that base. And then I talked at least once on that, and I saw some follow-up emails, and I know that was taking some effort. So thank you for what you're doing there. All right. Anything else on that, Andrea?
No, nothing else on that.
Okay. And I'm not sure if Derwin was able to join.
I have not seen Derwin, and I've been watching my text messages and emails. He's not responded.
Okay.
So
I guess we may have to come back to that topic then.
Circle around and see if we can get him at the next meeting.
Okay. Well, is there anything else while the group's together we needed to try to cover? Okay.
That's all for me.
If not, I will just thank the group again for joining and for the work that's happening every day to make this as good as it can be. It's probably never going to be solved, but you guys are doing, I think, a yeoman's job at making it what it can be. in difficult circumstances. So appreciate all that. And I hope everyone has a good day, and we will adjourn the meeting. Thank you.
Thank you all so
Thank
much.
you, Jim.